Achievement if you've worked down here on a busy night and saved a few lives, perhaps.
Jenny Goldsmith's been nursing for 12 years. Now she's at the top of her profession. As a charge nurse, she can't go any higher unless she wants a desk job. Her annual salary is just on $20,000.
Are you guys ready for this?
Yes, we are.
Okay. This young boy's just come in. He's got 2-week history of chest pain. He apparently is a renal patient, and he is the renal registrar.
It's 11 o'clock Friday night, the start of a new nursing shift at the Accident and Emergency Department of Auckland Hospital. Jenny Goldsmith and the other nurses on this shift can expect anything from cut fingers to multiple injury accidents.
This young lady has taken an overdose of halcyon an hour ago. She was wide awake, so she's been picked and she's had a good chuck.
And in between, there are cases that defy the imagination. Weirdos, they call them.
So she'll be having an issue. Actually, this has just become a problem. He's not rousing at all, so he might need to be washed out because he really is going to be just an overdose of alcohol, I think. Plus a head injury.
For their part, the nurses work to house surgeons, young doctors not long out of med school. And on call, the trauma team, the specialists. But the nurses are special too. They volunteer to work here, then must pass a selection process. There's nothing certain about working A&E. That's what most nurses find so appealing and rewarding. They like the pace, the variety, and as they put it, saving lives.
Oh, Perry is in theatre 3.
I noticed.
Okay.
That's why you were so keen to know what happened to him. That's why I wanted.
He was found in Ponsonby by some people, and he'd cut his wrist, his antecubital fossa this time. He's also removed some of the stitches from last time.
Did he just get sewed up last night and he went away home?
Well, he hadn't been sewn up when we went in got 7 because we left him too last because of, being too busy with everybody else.
He was seen by the psych people this morning, I gather, and he was discharged because he wants to be committed because he doesn't want to go to prison.
Right.
You're in Auckland now. Oh. Okay. How are you feeling? Jeanette? Wakey, wakey. Just look right up at the ceiling.
Oh.
Okay, I'm going to have try and have a look in this eye, all right? No, okay, we'll wait till the doctor comes.
Hello,
Jeanette.
Jeanette. Hi. My name's Barry Snow. Can you hear me?
Oh.
Hey?
Oh.
Open your eyes, Jeanette. Open your eye. Come on. Come on. Open your eye. Go on out. Come on, open your eye.
Yeah, well this one's sick too, I'm afraid. She's probably got a basal skull fracture, and she's been involved in an RTA about 9 o'clock this evening, and she's really only responding to voice. She's not opening her eyes, and he says she has to come to 16 Neck. He'd like a space name.
Got this medicine, all right, which is just help take away the pain and make him feel a little bit sleepy so that we can fix up his finger. You want to come and sit down? It's probably best if you give it to him because he'd probably take it better from you than me. Would you sooner use the syringe to squirt it into his mouth or the...
She might as well have that on.
Now we're going to put a wee prick in the back of his finger, which will sting. covered.
Yes.
Yeah, we won't know until our vehicle gets there. If he does transport, probably.
Oh, I see. The ambulance hasn't actually arrived at the scene.
No, he's still well and truly en route to it.
That's fine. We just understood the patient was quite sick, which if so, we were just wanting to have doctors down here waiting if that was the case. So we'd appreciate a R40 just before the time they arrive.
Okay.
Thank you.
Right, bye-bye.
I mean, if he's still... No, because if he's still unconscious when he is coming in by ambulance, he'll be a trauma call.
Okay, fine.
Thanks. 40. There is a certain amount of adrenaline excitement when there's sort of all the drama and things that can happen and come through here. I mean, it's the back door to everything. There's not many people come into hospital except for arranged admissions without coming through here. So I suppose you do get a lot of drama. I mean, you also get the routine, a few routine things as well. I mean, it's certainly not a glamorous job. And I mean, it's not for the money or the hours, as we were saying before. I think also just it makes you more aware of yourself and how you can cope and react in an emergency and just knowing what to do, which is something you don't learn the same upstairs in a surgical medical ward. Someone who's been found unconscious in a swimming pool and the neurosurgical registrar has accepted him. Oh. So I just asked that we get an R40 nearer the time, because if he's still unconscious and a problem, then we'll put out a trauma call.
They've spoken to Grace now.
Well, we understand so. Whereabouts, Carlos? Can you point to it?
Sure. See the lady again.
Seek help, bro.
That's just in your big toe there. Okay. And just this little bit on the side. Anywhere else? This foot's all right, is it? You didn't step on it with this foot? Yeah. No. So it's just that foot. Okay, well, we'll get the doctor to have a look at it. Right, Rosemary, perhaps you might like to go to tea now, if you wouldn't mind. Is C1 clear?
Yes, I just haven't rung the ward about...
Okay, fine.
I'm just getting an escort.
Are you talking?
No.
Do you want to go to tea when you finish that as well then, please?
Okay, I'm just doing an escort for him.
Mr. Cleaver, okay, and I'll just ring the ward then. Right, we'll see you later. Yes, okay, I'll hold you chat. Are you ringing Miss Baton? Yeah.
Black flag has more kill power in the air to...
I like the fact that you don't know what's coming, therefore you've got to be prepared at all times, so you've got to always be ready to go at an instant's notice. I mean, 1 minute you can be really quiet, the next minute you're really flat tap.
Dived into the swimming pool at 9:30. Hit the bottom. Was unconscious for 2 minutes and was unconscious when pulled from the water. He came round and vomited just after he gained consciousness. He's hypersensitive down his left side and hyposensitive down his right side with motor reflex damage and everything. But he's been quite stable, he's quite conscious with it.
Just move that right leg again. Okay, just try and move your toes on your left leg. On this leg? Okay.
Well, the patient is here. I think they're thinking of referring an orthopaedic, if you'd like to come and see them. All right. In fact, this way now.
No, the same way as what you said initially. Those shoulders. Just slowly. This one? We go?
Yeah.
Yeah. Ready? Just slowly. Okay.
Underneath our
Okay, that's good. The,
Okay.
right. Consistently warm. Right. Right.
I can see the world
Right.
now.
Is there was a reflex?
These are sandbags.
Right. Okay. We'll on the other side.
I'm trying to find out where this patient is.
Mark told me to reach out.
Right.
Yeah.
Okay, so
Hang on.
what were you wanting to say then, Anne? Just to tell me, or
Yeah, and do you want me to pop her up?
I think that's probably the best way.
Okay.
Hang on half a second, I'll just speak to the staff nurse in 4B.
Got a pin here, eh? Feel that's all sharp?
Yep.
What about there? Is that sharp?
Yep.
And there's that sharp?
Yep.
And is it sharp down here?
No.
Not sharp there, eh? What about this side? Sharp?
Yep.
Sharp in here?
No, it's not actually.
So there, what about there?
Yep.
That's sharp there. Okay. Now what about there? Is that sharp or blunt?
Sharp.
That's sharp. And what about this side?
No.
Right. Sharp
Yep.
and blunt there, eh?
He's had though. Oh, that's 2 or 3 hours now.
And he's fine otherwise, eh?
It's most likely to be crash fracture, is it?
Yes, probably, yeah, or hyperextension and then the vertebra shatters like that. Is it? All depends how much lesion there is. Yeah.
This is a weak feed at I've been in scaled all night.
Have you?
Would have had decent carries and things like that. This is
Paul's got it.
This is
That's his lateral neck, by the way.
Oh, should we just finish off this, eh? Well, you probably cracked one of the bones in the neck, I think, eh? It's damaged the cord a little bit, the spinal cord. It's only damaged half of it. That's why you're weak on one side.
Can't see my face, can you? Oh, sorry.
The people you really get annoyed with are people that just come and annoy you all the time and stop you from doing your work properly. Perhaps friends of drunks and saying, come on, why aren't you doing something for Joe? Drunk friends of drunks that aren't quite as out to it as the patient we're treating. They can be annoying because they really get in the way.
I know you. You're out in the waiting room and we'll give you a call from out there. Staff nurse has seen you.
Oh, it's been years ago, but...
But all these other patients. Come on. Yeah. We're a wee bit busy. So you take a seat out there and we'll come and give you a call when someone's ready to see you. Go on. You go and look after your friend. All right? You take a seat out there. I promise you, I've got your card through here.
100 4A, room 1.
No, you'd have to ask someone in the waiting room for that. Or you go down and talk to the security fellows. They might have a cigarette.
Oh, they might give us a punch in the face.
You what?
They might give us
Who, you?
security.
Oh, no. They'll be
They
right.
don't mean give us.
Okay.
They always do that.
Age, approximately...
I'm going to put a piece of gauze on your nose with some cold stuff. Okay, see if we can stop that bleeding. All right?
I'm just coming up to the level.
He's just going round the corner for me, actually, Jane.
Can you push?
Come on, you fellows. You wait out there,
Patient, just around there,
please.
thanks. Just around the corner.
No, he's all right. I'll look after him.
Is all right?
Yes, he's all right. You wait out there in the waiting room. Come on.
Yeah, just on this bed here. This is my bed.
Oh, you just got hit on the head. Come on, Alex. You wait out here.
Barbara,
Yeah.
this is going to might sting a bit.
Yeah.
try and stay awake, love, and to hold that gauze on?
Yeah, I have.
I'll be back in about a quarter of an hour, all right? And I'll clean you up and you can go. Okay? It's all right.
Now, you just pull the stretcher down a little bit.
Thank you. MSU5, which is the
Okay, so you're going to stand up for us, all right? Oh, I can't lift my leg either, Mark. No. Yes.
Come on then.
I'm sure you could stand. Come on, stand up. That's the fellow. Okay. Thank you very much.
Okay, mate. That's it. Get right on. You hurt yourself. Can you tell me your name?
We're probably all split in two over situations like that. Inside of us wants to tell them the truth, and the public front can't.
See, they're in no state to listen. I mean, you could say anything to them and they'd probably wake up the next morning and they wouldn't remember being here. Half of them, they're so drunk.
And quite often some do seem genuinely surprised that they behaved the way they did. But at the same time, you've got to put up with the ugliness of it all, the smell, the sight. You know, all your senses are assaulted by these people.
So you don't consider me, all you consider is what?
No, we wish to interview you about drinking and driving. You've been involved in an
accident. You just want to belittle me. Well, why aren't you out there in this? You know how wet it is?
Yes, I attended your accident.
They can't even.
And you have been drinking.
They can't even play cricket today.
Yes, thank you.
That's all you're interested in.
Hi, Doctor. Who's in charge of this chap here? Oh, thank you very much. We want to interview him about drinking and driving.
On the road.
Too bad. So we'll have to get a... Thank you very much. Appreciate it.
People's welfare.
Yes. You've been drinking too
Which
much,
you,
my friend.
no, I have. I don't.
Don't push me.
Yeah, well, get out of here.
You're assaulting the traffic officer next to you.
Yeah, I'm assaulting you. I'm not supposed to be. Oh, God.
How much did you have to drink before the accident?
I told you 3 or 4 times.
Well, I'll see if because the cops snap me to see before the cops want me to see before they go any further.
The nurse. No,
fine. You mean as far as right, okay.
Leave me alone. I just told you. Leave me alone.
I'm afraid they've given me permission to speak with you.
Oh, they didn't give you permission. I give you permission because I got sick and tired of them coming requesting. Shall I come and talk to you?
Don't tell me how the accident occurred.
Oh, yes, you interview me any time you like. If you're a gentleman, which I don't think you are.
We don't wish to be this.
Get out there on the roads and look after the people.
You're not drinking and driving.
No, I have not. Don't come here with that rubbish.
Where are you going, dear? Come and wait in this room, please, just while I get the phone, all right?
Oh, just some toilet, please.
Okay, I'll get that for you. Can you just wait in the room there for a minute? Just sit here.
What a treat just wasn't it?
Okay. Excellent music, partner charge.
Hello? Yeah, you won't tell me what his name is. He says you know.
Right. In actual fact, there's one that needs a few other things. Skull's chest, clavicle, tib, fib, knee.
Well,
Which I probably will send first because she's an escort patient and a little bit sicker than the other one. Okay, thank you. Bye.
well,
Actually,
if you think that would be good, because
hello.
it really doesn't
Hi,
matter.
it's Haney. I'll send the chest, which is just a little wee tot first, actually, because you'll have finished that by the time I organise the next one.
You're in hospital. Feel a bit cold?
Hi, there's nothing different, is there?
No, I just want to get his BP again because...
Hello.
Oh,
Can you remember much about what happened to you tonight? Okay. Do you remember being in the car? And then what was the next thing you can remember? You don't. Do you remember coming to hospital?
yes.
Right, so you remember waking up in the ambulance, do you? Do you know what the day is today? What is it?
Same Sunday.
And what's the date today?
You got your, is this open?
Over that side, is it? Okay. That over here.
Just over there.
Was he driving with a stroller? You've got a drip in your arm here, so you'll have to keep your arm straight, okay? If you can remember that. Just take your blood pressure.
100. Strong.
I'm just so here.
No, that's after the second unit.
Yeah, you tell the nurse, wouldn't you?
70, so-
I'm just over here. Yeah, you tell the nurse. Just over here.
Okay. It's all right on your hips here?
Everything's all right.
Okay. You move your leg, bend your leg up for me.
Yep.
The other one? And your back feels all right?
Yes.
Okay.
Ring 9, your time out is 2212, code 2, to the corner of College Hill and New Street, Ponsonby.
We had a Capri that was heading north on the motorway, and you crossed the median strip and hit a Bedford van that was heading south on the motorway, and you came back across and hit the Capri again. You're a bit lucky to be here.
Who was in my car?
Just you.
It's very frustrating when you see accidents coming in with people having had perhaps too much to drink and they obviously shouldn't have been driving, and where they've perhaps, you've often got the person that caused the accident who's perhaps had too much to drink, plus the people who've been involved in the accident who perhaps haven't had anything to drink, and I mean sometimes it can be tragic, and that's quite frustrating when you've got someone who really, how shall I put it, if it's just sometimes quite frustrating having to deal with both sides of the fence and remain impartial. I mean, you can feel a little bit intolerant to the person who perhaps knew they shouldn't have been drinking and driving. I mean, there's plenty of advertising goes on, but still chose to do that, and in some cases has actually damaged 2, 3, 4, even killed sometimes people. That can be quite frustrating. Or even just all the patients that come in that have been in fights and had too much to drink, and they come in, they don't want to sit still, they don't want to be helped, but they sort of insist on walking all around the department and getting in your way when you're trying to deal with other patients. But that's part of the job, I suppose.
We have on board a female of 30 years whose problem severity is severe as a result of a car versus pedestrian. This lady is deeply unconscious and has been for 45 minutes, unresponsive to painful stimuli. She has visibly minor lacerations of the head and a compound fractured femur. She also had a fixed left side dilated pupil unreacted to light. Her breathing is shallow at 24. Her pulse is irregular at 55.
A critically ill accident victim, a trauma call for the specialists, and for the nurses, another life or death situation.
There's nothing you can really teach people about death and dying and what happens. You come across and you learn to deal with it in your own way, and often you need lots of support. And there isn't anything special you taught about it, other than you know that all the other staff in the department go through the same as you, and so you get a lot of support from them. And it's something you have to try not to become too emotional about, because you're the one that's affected if you start to be worried by it and get upset.
Okay, Kirsten, here we are.
Okay, thanks.
I'm going to get you.
What's the story then?
Probably needs steering.
Would someone like to take a blood pressure? Hello, open your eyes.
Blood roll these on. Get them?
Give it that second time.
I'm not too sure about her neck though. Apparently she'd been up in the air and was thrown all over the front of the car. So we put the collar on and back.
Doesn't look good, does it? Where do you...
She's got a small laceration to the side of her head there.
Yes.
And blood there, but where it's come from I don't know. She had that much hair I hadn't been able to find it.
She's not moving any of her limbs.
Okay. What's the pulses? She moves their hand this way. Yep.
Where's the left arm?
Move the right hand too.
Has someone drawn any blood up?
Yeah, we got some tube over here.
She's not the right place.
Okay, now, has someone set up some mannitol? What percentage is mannitol? 20%. If you can run in 300 mils over half an hour. Now she was flexing both her limbs before. She won't now, she's paralysed. Do we have some Pavulon? Give that. I'm not quite sure of her age. Looks about 30. Who's been knocked over by a car and rendered unconscious, and she's bleeding from the back of her head.
The woman never recovered from her injuries.
Fracture over the
She
back of her
died
head.
later that morning.
She arrived with a fixed dilated pupil on the left.
What? You don't need this
More
anymore?
reactive one on the right.
See ya.
You don't think about it until a decision's just about imminent, or it becomes impossible to save the patient. Until that happens, it all stops her out. You're just trying to save the patient. You don't think about it at all until it becomes obvious that you can't, and then it's just one of those things.
How do you feel?
Well, you think about the patient's life and the people that are going to be affected, but on the other hand too, you might feel perhaps that it's better for the patient. They might not have had nearly as good a life after the accident. They might have had brain damage or something, and life would have been totally different. Sometimes they're better off dead, really.
Mr. Tony, David Tony. Been out drinking this evening. He's come home and has with his wife pushed him through the glass door. He's got a laceration from there, local area. It's opened up quite a bit and set an artery. Okay, we've got 3 bandages and 3 dressings on him. It's still coming through.
You been here before?
Yeah.
How long ago?
Oh, Jesus, look at him.
More than 2 years ago?
I'm not sure. Is that for heroin over there? Hey, listen. She wants you.
Have they seen you yet?
No, you've seen me yet.
If you want to put your cigarette out, I'll try again.
David?
Yeah.
Do you remember how long it was before the ambulance arrived to pick you up?
What?
About 10 minutes.
Oh, that's a good idea.
What's wrong?
Skin farm? Yes.
Just put a clamp all the way around it. It's a nerve.
Sorry, David.
What I might do, she needs a head injury shunt. She's supposedly being raped, which means you need to be very careful that you don't actually touch anything that could be evidence. I'd be inclined to leave her in the clothes she is now. Perhaps have a look at the cut underneath to see the significance of it. Check with her that there's no more injuries and that what she can remember, and start on a head case sheet.
Okay.
All right, just a lot of the clothes can be used as evidence, so we'll undress her later.
Can I get your issue, sir? Start your message, your issue, sir. Never. Thank you. Your issue, CCC. Good evening, can you read? Loud and clear. Roger, this is meeting 25. One mobile.
Let's go to the wall again. Now look at 4 stop warnings.
Before you guys get yourself involved in
You want to interview patient. That's right. What's your full name? Shouldn't you be, you know how witnesses out there? Do you know how witnesses? What's your full name?
I'm not particularly bothered by the stress, and I think probably most of the nursing staff that come down here are usually able to cope with it. Sure, it's hard initially because there's a lot to learn. I mean, up in the ward you can be a senior staff nurse, whereas you come in here and you actually start at the bottom of the rung again because you're a junior staff nurse, and I think it virtually takes about a year before you feel quite comfortable. So it often seems to attract a similarity in personality of nurses, people who perhaps can handle stress quite well. I am not always fussed about the hours, but then I enjoy the job. I mean, we work most weekends. Ideally, we're meant to get one weekend off a month, and that's fine if that happens, but it's still not a lot of weekend time to spend with developing sports, family, friends. But then you've also got to weigh up, is the job more important than the hours? No one likes night duty, but it's part of the job, so if you want to stay and enjoy the job, you're going to stay and doing night duty. And then, luckily everyone takes their turn, so that's not a problem. I think the only thing, and doesn't particularly nag me, it's just a little bit sad in a way to see the way, I mean, I wouldn't like to generalise, but just the type of people who are now coming to the department and perhaps abusing the system, who have got no backup, no social support, no money, and we seem to see quite a lot of those sort of people, and there's not a lot we can do. There's not a lot those people seem to want us to do, and so that can be quite frustrating. I mean, I think perhaps because Auckland's in the central city area, we tend to get all the people who perhaps live under the street bridges and hang around in sort of some of the areas in K Road. We get quite a few of the street girls and the alcoholics that live down there. We're starting to see a few more street kids actually coming into the department. They all tend to be central city area. It opens your eyes, so you're suddenly much more aware of the type of people that live in the city and sort of around this area. I don't think you necessarily become more cynical or hardened, and that I think that you still will recognise a genuine person who's nice and deserves to be treated as such. You probably become a little bit less intolerant of some of the people, some of the drunks that wander around and abuse you and curse you and hit you, and those you perhaps can be sometimes intolerant, although you do your best initially. But I think when there's genuine people who deserve the best of treatment, they still get that, no matter how long you've been working in the department.
Is this going to solve any of your problems? What are you, a psychiatrist? I don't know what you do.
Some of these kids come in there absolutely blotto, and they're only 14 and 15. And where are their parents? I mean, their parents don't come up here. You get the occasional parent up here who's absolutely horrified at the language that utters forth from their dearly beloved, and perhaps that something gets done then at home. The kid won't do it again, but parents don't seem to be involved too much, do they, really?
Okay, buddy. And we'll just get you to swallow this tube. When I say swallow, I want you to swallow hard. Just swallow now. Just swallow like that's it. Just breathe in and out through your nose. Just relax there. Smells pretty foul. Alright?
What an idiot. Stupid boy. What a waste of time.
Yeah, what a waste of time.
Because some of them, I mean, they take very dangerous things and they don't realise they can kill themselves. You just think, what a waste.
I think it's really sad. I've noticed that here there's so much more attempted suicides in the city. And I just think must be an awful lot of lonely people or psychologically disturbed people, and it's just so obvious here the difference compared to a smaller place. Really obvious.
We're coming to you from Glen Eden, a 2-year-old male. It's approximate 2 years. We haven't been able to get many details off the father. This child has been fitting. Patient is still unconscious, still moving around quite a bit. Has not regained consciousness for, as far as we can ascertain, something like 20 minutes or more. The child's surname is Gray, G-R-A-Y. Christian name Aaron. He has had a dose of diazepam given rectally by the father about 15 minutes ago.
Fine, we'll be expecting you. A&E out.
Aaron Gray.
He's still fitting. It's just about, he's unconscious and still
20 minutes. Okay, thank you.
And still fitting, so it might be just restored to the PVNZ people.
Know any names?
Yes, this one's Paul, this one's Philip.
Paul. Hi, how you feeling? Okay, I'm just going to have a look over those eyes. Just relax. Okay, you're not sore anywhere in particular? Okay. Alright, how are you feeling?
Sore.
Okay.
Sleep.
I think it's cold, don't you?
Yeah, it's shaking.
So look inside. Okay, that's fine. Right, hold on, Paul. We're just taking you through to a room. Just hold on.
Nice job, that's just good.
Please go. I'm going to go and find place to go with.
I know, but you're not allowed to stand up. Where's your shoes?
Gia.
Come on.
I'll be out there and how, where's it? How way to go?
Come on, you don't know what's wrong.
I will.
Sure, you could have banged my head. Come on, lie down for a minute. Let's have a sort of come on.
Peter.
Mark.
Yeah. Go on. I will. I've got nothing to move. Honestly, I promise you.
Where do you want to go? I'm not well enough and I'm not really cool. I won't be Some person is frightened of getting really hard from being A&E. I hope I have the incentive to get out I get that hard, really hard. Because it's so easy to get really hard and down here. You get a bit cynical, I'm afraid. You do get cynical and you get hard and you get some things, but I hate to get to the stage where I'm really very callous or, you know.
I've noticed that just in the 7 months I've been here, I'm a lot less sympathetic now to some people like the ODs that come in than I was when I first started here. And it frightens me. I think, what am I going to be like in a couple of years' time?
No, it's just that you could perhaps clean a bit of the blood and things.
You want to do it, you can do it. I don't think you're right.
Well, it's just that I'm not going to get round to doing it for a while, so if you want to sit like that for a while, that's fine.
Yeah.
Oh, these needles are hopeless.
That's the final one.
Have you got any?
Yeah, we'll have a look.
If you go along and see your family doctor, you can get those stitches taken out. Alright, if there's any trouble in the meantime, then you can either go along and see him about it or come along here, because we'll have a card, we'll have a record of it all, okay?
Yeah.
I could imagine that it would be nice at times to be thanked when you've sort of gone to a lot of trouble to treat someone who's perhaps not treated you very well, and they don't even feel it necessary to say, well, thank you very much, as they walk out the door. And there's quite a few patients that fit into that category.
Yes, certainly. Bye-bye, have a nice night. See you. Bye. Right. Will do.
It's now 7 o'clock Saturday morning. One shift's ended, another's taken over. Saving lives at Auckland is a 24-hour operation. It's been what the nurses call a regular weekend. Some weekends are described as hell on earth, with up to 5 hours wait for non-urgent treatment. What the nurses at Auckland Hospital are now dreading is the likelihood of nearby Green Lane Hospital shutting its doors each night at 10 because of staff shortages. If that happens, their workload will possibly double.